Hi everyone, welcome to this short video where we'll learn about the concept of NNT, also known as numbers needed to treat. We'll break it down step by step, use a simple pediatric example and help you understand how this number can guide better clinical decisions. My name is Dr. Said Kazmi, you're watching my YouTube channel. So the numbers needed to treat is a concept used in evidence-based medicine, also in health economics. It tells us how many patients they need to be treated with a certain therapy or maybe investigated with a certain investigation for one additional patient to benefit from that therapy or from that investigation compared to a control group where they won't have that therapy or they won't have that investigation. Or simply putting it, NNT answer these questions: how many children do I have to treat or investigate with this new medication or with this new investigation or therapy before one child truly benefits? Now, in pediatrics, we often see conditions that may have multiple treatment options. Knowing the NNT can actually help us choose therapies that truly make a difference for children. For example, if a medication for childhood asthma has an NNT of 10, this means that for every 10 children treated, one child extra, one extra child benefits compared to if they hadn't received the medication. Now, to calculate the NNT, we first need to understand the concept of absolute risk reduction, also known as ARR. Now, ARR is the difference in the risk of a bad outcome between the treatment group or the group that's undergoing investigation and the control group. The control group is the one which is not having that treatment or not having that investigation. So once we know the ARR or absolute risk reduction, we can calculate NNT, as the formula for NNT is equal to 1 divided by absolute risk reduction. That is 1 divided by ARR. It's that straightforward. For example, if a pediatric study finds that the risk for a certain complication without treatment is 20%, and if you are giving that treatment, it's 10%, then the absolute risk reduction would be 20%, that is a group that's not having any treatment, minus 10%, that is the complication rate in the group which is having the treatment, let's say. So 20% minus 10% would be equal to 10%. And if you convert this, if you remove the percentage, that's 10%, as a fraction of 1 would be 0.10. So as I told you, NNT is equal to 1 divided by absolute risk reduction. And absolute risk reduction in this case was 10% or 0.10. So if you divide 1 by 0.10, that equals 10. So the NNT is 10 in this case. So in other words, you would need to treat at least 10 kids for one extra kid to benefit from that therapy. I hope that is clear. Now also, let's imagine a scenario. You have a new probiotic medication. A probiotic, is these are nutritional substances that are said to reduce antibiotic associated diarrhea in children. So let's say a study has been done on a new probiotic for antibiotic associated diarrhea in children, and in that study they found out that those children who are not having the probiotic, 20 out of 100 children, they develop diarrhea. That is let's say 20%. Those children who had the probiotic, only 10 out of 100, that is 10% of them, they develop diarrhea. So the absolute risk reduction would be 20%, that is those kids who did not have the probiotic, minus 10% kids who had the probiotic and developed diarrhea. So that would be equal to 10%. Again, 10%, if you remove the percentage, that would be equal to 0.10. And if you divide 1 divided by 0.10, which is a formula for NNT, the figure would be 10. So it means you would need to give probiotics to 10 children in order to prevent one child from getting antibiotic associated diarrhea. Now, this may not sound dramatic, but it's meaningful in population where a large number of children are treated with a particular therapy. This information can help pediatricians decide if the intervention is worth it, taking into consideration the cost, the possible side effects, and also the family preferences. Now, an NNT can vary widely. Some therapies have a very low NNT, let's say 2 or 3, which means the treatment is highly effective. So anywhere the NNT is low, the treatment would be highly effective. If the NNT is high, it means it's not effective. Now, some other treatment options might have higher NNT values, like 20 or 50. That would suggest that in some cases, while they may be beneficial, basically a high NNT means that you need to treat so many large number of patients just to see a single additional positive outcome. So probably it's not that cost effective. So in pediatrics, therapies with a lower NNT might be more attractive, especially if the intervention is safe and cost effective. Now, the higher NNT is not good and doesn't, but remember one thing, there is a caveat here. Higher NNT doesn't automatically mean the treatment isn't good. It might still be the best option if the alternative treatments are, let's say, less effective, they are more expensive, or they have got more side effects. The decision also depends on the severity of the condition being treated. For example, if you're trying to prevent a very serious complication, even an NNT of 50 could be worthwhile, which you might not consider in other scenarios. So as a pediatrician, NNT is just one of the many tools. So you combine NNT with your clinical judgment, with your patient values and some other evidence. It helps you make the best decision for each child. Now, good clinicians, they always ask, what is the NNT for this treatment or investigation? What are the side effects? What are the costs? And does this align with the family priorities? So to recap the whole thing, NNT tells you how many patients they need a treatment for one extra patient or child to benefit. Number two, it's calculated as the inverse of absolute risk reduction. In other words, 1 divided by absolute risk reduction. Number three, in pediatrics, it helps guide decisions by highlighting treatment value. And last but not the least, remember, it's not the only factor. Clinical context, family preferences, and side effects, they matter too. So thanks for watching this video. Now you know what the NNT is, how to calculate it, and how it can help you in making informed decisions in pediatric care. Please don't forget to like, share, and subscribe for more simple explanations of important medical concepts. See you next time. Bye-bye.